It is a public health travesty.
Those are strong words from doctors and patients to the FDA about medical device dangers after 2 days of hearings in Washington, D.C. during this past week. And tonight, the possibility that real change could happen, especially for metal implants. Here's Terry Gruca.
The FDA is not doing its job.
Not exactly what you'd expect a doctor to say about a government agency tasked with protecting patients. But Dr. Stephen Tower is more than an orthopedic surgeon. He's also a patient, poisoned by a metal-on-metal hip implant.
I lost all the tissue around the hip.
Dr. Tower shared years of research after studying the effects of metal implants on people around the world, like Austin mom Frances Scott.
I'm in daily pain. I can be on my feet about 1 to 2 hours a day unless I'm medicated with Celebrex or narcotics, which, as you know, have terrible, terrible side effects.
From pain to neurological and heart issues. Doctors say Linda Raddick's heart failure is caused by metal poisoning from her implanted hip.
Stop trying to change patients. Stop trying to throw a pill at an immune response. Change the materials.
The stories shared with the FDA this week are nothing new. The same type of hearing happened nearly a decade ago.
The Food and Drug Administration, born out of the progressive era at the beginning of the 20th century, has increasingly become a captive of those that it is charged with regulating. And it has not been forceful enough or creative enough early enough to protect patients.
Currently, the FDA has no requirements that medical device companies disclose the materials of the devices implanted in people.
You guys are asleep at the switch. This stuff is happening to hundreds of thousands of Americans, and you're doing nothing.
That was Terry Gruca reporting this August. The FDA began to roll out some changes, which include requiring medical devices to have a unique device identifier, or UDI, a label that helps patients identify what is implanted in them, but it does not currently include information about the materials that make up the device. That may be one of the changes that we see in the future. You can search the database for information on 2 million devices. Go to the story on KVUE.com. Terry's done a lot of exclusive investigating reporting on that.